Hi, Dave with Align Therapy here. I wanted to share some insights recently that I've had in the treatment of adult scoliosis. Adult scoliosis is something that I see all the time here in my clinic in Lehi, Utah. And sometimes it can be challenging. Adult scoliosis comes with a lot of other things. Comorbidities, degeneration, arthritis, I mean, you name it, it can come with it. But we still treat scoliosis in adults with the Schroth Method. And the Schroth Method is very effective. And I find that one thing specifically stands out in the first couple of times that I see someone, that they love to do semi-hang. They love elongation and they love traction on the back. And so I wanted to talk a little bit about that and show something with that. But hopefully this is helpful to you. You might be an adult with scoliosis yourself, and hopefully talking about things that I find helpful in my other adult patients is helpful to you. So don't forget to subscribe to the channel. Stay tuned for other things. I want to do more videos about adults with scoliosis and treatment options, because there's a lot of videos about adolescents and kids, but there are many more adults living with scoliosis than teenagers living with scoliosis. So let's get into it a little bit. Traction or elongation or semi-hanging, we're kind of talking about the same thing, but there's a pretty significant difference between some of those things. So in the Schroth Method, we do a lot of elongation. We're doing active elongation where we're trying to get breathing and muscle activation to elongate the spine. We're learning how to fight against gravity. So that's an active elongation. The hanging that I'm talking about is a passive elongation of the spine. So when I have a patient do semi-hang, that we're using gravity to help us elongate the spine rather than trying to fight against what gravity's trying to do. Hopefully that makes sense, because we're allowing elongation. I get a lot of people asking me about two things. One about traction or decompression that they may have seen in their chiropractor's office or somewhere else. And they ask me about inversion tables. Inversion tables are a tilt table that you strap yourself into, and then it goes upside down like this, and then the weight of your body does some traction force on your back. And so I have a lot of people ask, what about an inversion table or a traction table? I'm not opposed to inversion tables and traction tables, but we lose a little bit of the control when we do that. What I mean by that is we can control when we're doing a Schroth elongation or semi-hang. We can control what's happening with the spine. You can't always do that when you're doing traction or an inversion table. So let me show you what I mean by that. Let me move this camera a little bit. So if we're doing a semi-hang where we're hanging on the bars like this, what I mean by controlling this is that I can control how arched my back is by just doing some simple movements. So I can control how much lordosis I have, I can control how much kyphosis I have, and I can get into a good neutral position and still let gravity pull down, and there's still some muscle activation happening as I'm doing that. So, and we're breathing, we're expanding. Of course, in the Schroth Method, we're breathing a lot. So I really like semi-hang because it allows us to expand and elongate passively. So when we're doing, when we're doing traction or we're doing an inversion table, it's a lot harder to control what the lordosis is doing. It's a lot harder to control diaphragm breathing and expansion. And so my preferred way is to do Schroth Method semi-hang. Not that inversion tables can't be helpful. I have had a lot of patients who have used them and have found them to be helpful, and that they feel like they have some benefit from that. So if that's you, great. I'm not saying not to do that, but we also need a little more controlled component to it. We need the active component. We need some muscles still being active, stabilizing the spine while we allow for that elongation. So again, not saying traction can't be helpful and inversion tables can't be helpful, but I really like the way that semi-hang keeps some active component and keeps the control with the elongation. So if you're someone with adult scoliosis that has back pain specifically, You may have some arthritis, you may have some other issues with your back. If you are that person, I would say 90% of my adults with scoliosis really love to do this semi-hang exercise. It is something that isn't just, go home and hang off the railing on your banister or something like that. It does take some training and some instruction on how to do it appropriately and how to maintain that lordosis and that kyphosis and how to be in a good angle and position. So I wouldn't recommend doing this on your own necessarily. The best way to do this is to find a Schroth Method certified provider that you can go and see, and they can guide you through how to do this. This semi-hang exercise isn't the end-all exercise with our scoliosis program with adults. This is just the beginning. It is the thing that most of my patients gravitate to because they really like it, but this is just the start. The rest of it is learning how to elongate against gravity, how to expand those concavities, how to open what's collapsed, and how to correct for the imbalances that happen. So that's where we really see good benefits. But most of the time in the short term, this semi-hang is money for our adults. So hopefully that was helpful, and stay tuned for more information on adult scoliosis treatment, and we'll see you next time.